Today we're meeting Margit Alt-Murphy, who's an associate professor at the University of Gothenburg and a senior physiotherapist at Sahlgrenska University Hospital.
So this is our arm lab, where we do the movement analysis, also called kinematic analysis. And for that we have a setup of several cameras here that are high-speed cameras, and they flash out infrared light. That is possible to see then when we have the small balls with reflective balls. Then we attach in different parts of the body. For example, in we can double-sided tape, and we put them in those parts of the body where we want to look at the movements.
Okay.
So we do the arm analysis of arm movements here, and people coming here for the research studies, then we have, for example, here they are sitting in the table, and we do a drinking task assessment, which is standardized assessment, when we have the markers on, and then we can see how people are using the arms when they do their normal daily task, like this one.
Okay.
And the camera is around here.
What is it that interested you in this field?
Many things, but the first of all is, of course, patience, and my interest in movement and how the movements can be impaired after different diseases or conditions, and how people can recover and train different movements to get back the normal motor control, and can use the hands in the daily life again. Because the hands are very important parts of our body. We use them every day. If you just have some smaller injury in your arm, you will notice right away that it's very difficult to actually do things. Everything takes much longer time, and you see that you are using your arms quite a lot in everyday life. But so then, of course, I want to help people in my profession, physiotherapist.
So why is it important that we can use both our hands?
It is very important, since we have two hands. There's some meaning with that one. And but we use usually our hands a little bit differently, depending what we are doing. For example, we are better on our dominant hand, usually the right one, is better on some tasks, and our left arm, non-dominant, is better on other things. For example, we are stabilizing more with left arm, and the dominant arm is doing more precision tasks. So they have different work to do. And then, of course, we can manage quite many things with one arm, but it's not very natural movement. And the hands, they are also connected to your body. So what happens when you have a difficulty to move one hand, your body will also be influenced by that. You will change your body position, and maybe you're not getting more asymmetric in your body positions, and it will be more difficult to use your arms.
Oh, okay, so we actually have two different purposes. We have one dominant and one not so dominant hand. Yeah, okay.
And research shows quite nicely that we use the hands in different ways. And most of the daily activities are manual activities, which means that we spontaneously use both hands, even if you can just take a class with one hand. But what we do, we take class and then we change the hand, taking to down, and we're taking something else. So both hands are quite involved in different activities.
Okay. And if you are so unfortunate to suffer from impaired hand functions, what are some of the risks of not receiving any treatment?
I can give you one example from the field I am working on. It's stroke rehabilitation, and that's very common. It's that you have one side body is affected, and you have paralysis, so you can't move your arm or leg as you did before. And especially in the neurological diseases and stroke, it's very important that you start to use your arm or hand as much as possible, because this is that drives the recovery and helps also the brain to use the plasticity of the brain, so the neurons find the new connections around the stroke core area, and in this way the use of the arm will trigger this kind of transformation during the recovery.
Okay, is this where also motor learning perhaps plays a part?
Motor learning is the core of the recovery and the training, of course.
Training, yes.
So, and that we use our bodies and we use them in an efficient way. So first learn how to use your arm again, and then also too many repetitions of that movements. So it's a skill learning. You relearn your skills.
Interesting. Terminology that is quite commonly used is context specific training. Is that something you could expand on?
One of the principles is that the training is task specific and context specific, which means that you can train different parts, but the better training is when you train your arm function in the situation where you want to be better on. So you want to be better on reaching, then it's good to do many different reaches using different objects and moving them to the different parts, and then eventually use the body in normal objects in your everyday life. So that's the task specificity and the context in your normal life.
Okay, so if the patients can continue the rehabilitation or training at home, that would be even better then?
That's very good, because the treatment hours are usually maybe only half hour, maybe an hour, and then all day could be a treatment when you use your arms and you're trying to integrate your movements and find the normal way or alternative way to move and use the arms.
Okay. Is there anything about the research that says that there's a minimum amount that need to be used or trained during a day, or?
It can differ. For taking example with stroke again, then it's very important that you have a professional rehabilitation teams that help you, and it includes both physiotherapists, occupational therapists, and nurses and physicians working as a team, because there's so many things you need to usually help with. And the training dose is very important, that you get many repetitions and quite many hours, especially early, but also longer. Research shows that also when you are coming to this so-called chronic stage, maybe 6 months after you had your stroke, then it's even important to try to utilize those use-dependent, learning-dependent mechanisms to improve your skills and task performance in different ways.
You mentioned relearning. Why is that important?
If you only use your one arm, or you use your arm very different ways, then after many months or weeks or even years, you will get pains maybe. Your muscles will also get shorter when you're not using your arm. So it goes into the vicious cycle when first you have difficulty to move, and then you're moving your arm less and less, and then even the muscles getting shorter and the joints getting more stiffer, and you get more pain.
Okay.
So you want to avoid that, and you also want to avoid to have this very asymmetric body position, because that pain will go further for the shoulder, and then maybe you have pain in your back, and the whole body can be influenced. Okay. So we are symmetrical, and it's good to use the both sides.
Okay, so this is why the body compensates for the lack of use in the other muscles.
Yeah.
Okay. I think most of us can understand the practical aspects of not being able to use both your hands, but are there any other benefits, perhaps from a psychological aspect? being able to use both hands?
Yeah, when we come back to the hands are very important tools for us. They are both physical to use as a tools, but they are also sensory tools. So, and all that input that comes in, so many people that have difficulties to use the arm and maybe recover, so they can after that feel that, oh, my body is coming back, I get back my hands, I can use both of them again in a normal way. And then you forget it because then the pain is away and everything is good again.
Do you see your patients perhaps getting their confidence back in some way, being able to perform activities in their daily life?
It could be like that, yeah. But also everything gets easier in everyday life. You don't have to think, oh, now I have to do the movements, so you do it more naturally. Everything goes faster. What happens when you have difficulty to move your arm or use the hand in every day, then it gets very slow. Everything takes longer time. So that's psychologically, it's of course important to get back your muscles, or at least get some another tools or ability to integrate both arms in the daily activities.
You mentioned earlier the importance of being able to put in many hours in your training and to also be able to do it in your home environment.
Exactly. This is the best way to train or exercise and use your arms. And the treatment hours are limited, and healthcare also. At some point you will go home and you need to train yourself also. And then it's very important to get the training possibilities in your everyday life activities. So if you use arm during all those hours when you are at home doing different tasks, but what you will do anyway, cooking, washing yourself, cleaning, hobbies, or maybe even you think of your leisure activities, you want to take up and play golf, or whatever, you meet your friends and have those social, participate in different social activities, then you get more possibilities to use your arms.
So in other words, your hobbies then becomes part of your training.
Exactly. If you are able to integrate your impaired arm in some way, maybe it's not fully as it was before, but even when it's just supporting, it helps again already. Then you think you do something that you also like to do, you have to do anyway, and you get the training just by doing that.
So if a person do their rehabilitation at home, how do you know that they are actually getting better?
We use different clinical assessments first to look at how they perform before and after the training, because it's very important, both myself as therapist, but also for the patient, to know if they have improved and what parts they have improved. So they usually not only one test, but we do several different tests to look at maybe muscle strength or movement performance or sensory performance can it also be. So, and this is the one part when we observe, and the other way also what the patient is feeling, if how getting better on some task. So then we usually use questionnaires or so-called patient outcome measures, reported measures, where they just themselves maybe look at a different task and how well they are able to perform them, to see if there has been an improvement.
Okay, would it be possible for you to show us?
Yeah, of course. So, for example, one of those, if you look at the grip strength, it's very easy to use hand dynamometer. So, and that's usually patients like also because it gets a little bit like a sport. But here you press as much as you can, and you redo that test at least 3 times. So you look at the average grip strength, the maximum grip strength, for example.
Oh, okay.
So, for example, this is an action research arm test that we use quite often.
Mm.
And here we have different objects. So I instruct the patient to take this cube up on that shelf. Can you do
Okay,
that? You can
yes.
show just in a normal way, as you want. Like. So then we look at the time, how you do, and how you use your elbow and shoulder movements.
Okay, okay.
And another task, for example, here is when we look at different grasps. So this is a big grasp, but we look at this kind of grasp. So I ask you to put this up there,
Okay.
the ball, and then you take the arm. And even if I want to see even smaller things, more precise movements at different sizes of marble here, and you can take it with different fingers, but you can just take it with your finger and put it up there, and then you take your hand back.
Okay.
You can try that.
See.
And back. So in your case, everything is easy,
Oh yeah.
but it's
good.
not usually when you have difficult to move.
No, of course.
And I show the other one here, for example, the different grasp, and we have different sizes of tubes here, and here you take the tube and put it in the other one a little bit further away. So you can try it, that one also.
And this is also to get to reach forward then, I suppose.
Exactly.
Okay.
And nicely, you didn't have to go forward with your trunk or your body.
Ah.
What happens with patients that you take that and then you have to move forward. So we see also this compensatory movement here.
Okay, this is also a compensatory movement, okay.
So this is some examples from that test.
Interesting. Thank you, Margit, for meeting me here today and talking about the importance of being able to use both your hands and also showing us different treatment methods. It was really, really interesting.
Thank you.